Good day. This presents the infection prevention and
Standard precautions include the minimum infection prevention practices that apply to all patient care, regardless of the suspected or confirmed infection status of the patient, in any setting where healthcare is delivered. These practices are aimed at protecting patients and healthcare providers from the spread of infections. Standard precautions include hand hygiene, respiratory hygiene and cough etiquette, use of PPE, safe injection practices, and safe handling of potentially contaminated equipment or surfaces in the patient environment.
hand hygiene is the single most effective action to stop the spread of infection. This is a general term referring to any action of hand cleansing. It can refer to hand rubbing or hand washing. Despite its simplicity, hand hygiene is still poorly practiced in many healthcare facilities. In hand rubbing, you will use alcohol-based hand rub for 20 to 30 seconds. For hand washing, you will use soap and water, and this procedure will take 40 to 60 seconds. For the procedure of hand rubbing, apply a palmful of product in a cup hand covering all surfaces. And then rub hands palm to palm, right palm over left dorsum with interlaced fingers and vice versa, then palm to palm with fingers interlaced, back of fingers to opposing palms with fingers interlocked, rotational rubbing of left thumb clasped in right palm and vice versa, and rotational rubbing backwards and forwards with clasped hands of right hand in left palm and vice versa. Once dry, your hands are safe. In this slide shows the hand hygiene compliance for the hospital in the year 2020 onwards. This slide also shows the programs done over the years to increase the compliance of the healthcare workers for hand hygiene. This slide shows the validation of hand hygiene monitoring done by Clinical Performance Improvement Department, now the Hospital Performance Improvement Department, with the Infection Prevention and Control Department, last 2020. The green bar indicated that CPI and IPC monitoring was done, while the blue bar represents the CPI monitoring on the graph below. Since the staff knows the IPC staff, most of the units already know that they are being observed. We can clearly observe the Hawthorne effect, or the fact that people will modify their behavior simply because they are being observed.
We already know the proper steps of hand hygiene. Now the question is, when are we going to perform it? According to WHO, we have 5 moments wherein staff should perform hand hygiene. We have to perform hand hygiene before touching a patient. This is for the safety of our patient. Before you do any clean or aseptic procedure, after body fluid exposure, you have to protect yourself. So if you have body fluid exposure to any body fluids, such as blood, urine, and saliva. After touching a patient, and after touching patient's surroundings. Patient surroundings are also considered as infectious. Thus, even if you touch only the patient's environment, you have to perform hand hygiene.
Still part of the standard precautions is the respiratory hygiene or cough etiquette. It prevents transmission of all respiratory infections in healthcare setting. We are now required to wear masks at all times to prevent COVID-19 infections. We also are advised to avoid going to work if with respiratory symptoms, and to contact Employee Wellbeing Clinic and inform your training officer and chief resident if you are symptomatic and needs RT-PCR testing. Report to Infection Prevention and Control or IPC if with positive RAT or positive RT-PCR SARS-CoV-2, and participate in contact tracing activities.
These are the key factors required for a respirator to be effective. The respirator must be put on correctly and worn during the exposure. The respirator must fit snugly against the user's face to ensure that there are no gaps between the user's skin and respirator seal. The respirator filter must capture more than 95% of the particles from the air that passes through it. It is also important that fit check or testing should be performed when using a respirator.
These are the important reminders on the use of PPE. Perform hand hygiene before wearing PPE. Gloves and gowns for patients on contact precautions should be worn even if you are in a positive or in a COVID unit ward. Full PPE is also required for COVID-19 units. Wear PPE properly. Avoid touching and adjusting respirators with contaminated hands or when inside patient's room. Change gloves in between patients. Strictly follow donning and doffing procedures. Perform hand hygiene during PPE removal and discard PPE in designated waste bins.
Before the beginning of a procedure that involves the use of a needle or other sharp device, ensure that the work environment has adequate lighting and space to perform the procedure. Assess the potential for the patient to be uncooperative, combative, or confused. Obtain assistance from other staff or a family member to assist in calming or restraining the patient as necessary. Ensure that the equipment necessary for performing a procedure is available within arm's reach. If multiple sharps will be used during a procedure, organize the work area so that the sharp is always pointed away from the operator. Identify the location of the sharp's collector and, if movable, place it as close to the point of use as appropriate for immediate disposal of sharps. During a procedure that involves the use of needles or other sharp devices, handling an exposed sharp, you should be aware of other staff in the immediate environment and take steps to control the location of the sharp to avoid injury to oneself and other staff. Do not hand pass exposed sharps from one person to another. If the procedure necessitates reusing a needle multiple times on the same patient, like giving local anesthesia, recap between steps using a one-handed technique. A one-handed scoop technique uses the needle itself to pick up the cup, and then the cup is pushed against a hard surface to ensure a tight fit onto the device. If using an engineered sharp injury prevention device, activate the safety feature as the procedure is being completed, observing for audio or visual cues that the feature is locked in place. Do not place needles on the patient's bed, on environmental surfaces in the patient's room, or left attached to the administration set and hung over the IV pole. Unsafe injection practices pose risks to both patients and healthcare providers. Needles and sharps should not be recapped. They should not be purposely bent or broken by hand. They should not be manipulated by two hands. They should be disposed. We have portable and wall-mounted sharps collector to prevent sharp injuries. What will you do in case you have an accidental exposure? Perform immediate first aid measures. First aid measures will be discussed later. Report to employees' well-being clinic or emergency department if the employees' well-being clinic is closed. Write an incident report within 24 to 48 hours. The incident report aims to determine the reason or the cause why the incident happened and not to blame the staff. Incident reporting is important for us to create a solution. These are the second level of basic infection control. These are to be used in addition to standard precautions for patients who may be infected or colonized with certain infectious agents, which additional precautions are needed to prevent infection transmission. We have airborne, droplet, and contact precautions. For airborne precautions, these are used for patients known or suspected to be infected with pathogens transmitted by the airborne route. These are diseases that can be transmitted through air. Examples of these diseases are measles, chickenpox, pulmonary tuberculosis, disseminated herpes zoster, SARS, MERS-CoV, and COVID-19. Since these diseases can be transmitted through air, patients should be placed in a special room or in an airborne infection isolation or negative pressure room. In a negative pressure room, the flow of air is inward. When you transfer patients in airborne precautions, the healthcare worker is required to wear N95 respirator, while the patient wears surgical mask. Don't forget to provide N95 respirator to the elevator operator. Due to COVID-19 and limited supply of N95, staff caring for patients with airborne infections should wear N95 covered with surgical mask and face shield or goggles for all patient interaction. For droplet precaution, these are used for patients known or suspected to be infected with microorganisms transmitted by droplets. Large particle droplets that are more than 5 micrometers in size that can be generated by the patient during coughing, sneezing, talking, or during the performance of a cough-inducing procedures. Examples of these diseases are pertussis, meningitis, influenza, pneumonia, and COVID-19. Patients on droplet precautions are placed in a single patient room, but if there is a surge of patients, we can cohort patients who are infected with the same pathogen. In response to COVID-19 pandemic, everyone with patient interactions should wear surgical mask and face shield or goggles. For contact precautions, these are used for patients known or suspected infections that are spread by direct contact or transfer of an infectious agent from one infected person to another without a contaminated intermediate object or person, or through an indirect contact, like a transfer of an infectious agent through a contaminated intermediate object or person. Examples of these diseases are multi-drug resistant organisms, C. difficile, and COVID-19. Patients who are on contact precautions are placed in a single patient room. Gown and gloves should be used for all patient interactions. For COVID-19, everyone is required to wear surgical mask and face shield. If you are handling patients on contact precaution, in addition to surgical mask and face shield, you will wear gloves and yellow washable gown.
Healthcare-associated infections or HAI are the infections acquired in the hospital. These are associated with break in infection control practices, and there's an increased risk among patients with medical devices. The transmission of organisms that cause HAIs occurs in many ways, like caregiver to patient, environment to patient, patient to patient, and these are all preventable. Those who access the healthcare system for illness or injury are expecting care and treatment, not additional illnesses and complications.
Types of HAI are ventilator-associated pneumonia, catheter-associated urinary tract infection, central line-associated bloodstream infection, and surgical site infection.
The slide shows the number of healthcare-associated infections per year. IPC monitors the high rates of the hospital. As indicated in the 2 years in the slide, it shows that CLABSI is the highest among the healthcare-associated infections.
For waste segregation, Makati Medical Center follows the DOH Healthcare Waste Management 4th edition released this 2020. All trash bins in Makati Medical Center are color-coded. Non-infectious or biodegradable waste such as leftover food, fruits, and vegetables are disposed in green trash bins, while non-infectious dry washes or non-biodegradable waste such as plastics, papers, packaging materials are disposed in black trash bins. On the other hand, infectious, pathological, and anatomical waste such as PPE, gauzes, sharps, and ampules are disposed in the yellow trash bins, while the radioactive or nuclear waste such as items contaminated with radioactive materials are disposed in orange trash bins. Before, sharps collector are disposed in red trash bins, but in the fourth edition of DOH Healthcare Waste Management, released this 2020, sharps collectors are disposed in yellow trash bins. Another change is the disposal of chemical, pharmaceutical, or cytotoxic waste from yellow with black band bin to brown bin. Please take note that the transition from yellow with black band bin to brown bin is ongoing. This is an example of PPE doffing area in COVID-19 units. Dedicated trash bins are available for each PPE. We have to observe strict waste segregation. Request housekeeping to collect waste if three-fourths full to avoid overflowing.
We would like to emphasize the hospital has many policies to prevent the transmission of COVID-19 infection among healthcare workers and patients. The current policy being practiced is to have a low threshold for testing for healthcare workers. All employees are required to teleconsult with employee health and to report if you are symptomatic or contact traced or has a disposition of high risk. If symptomatic, with COVID-19 symptoms or with fever, sore throat, severe upper respiratory symptoms, the initial screening to be done are the rapid antigen test. If the case is confirmed COVID positive, the employee will be required to isolate for 7 days as day 0 is the start of symptoms. Return to work after 7 days if asymptomatic for at least 1 day or mildly symptomatic with improving symptoms or as assessed by Employee Wellbeing Clinic. There is no need to repeat testing prior returning to work. If negative, you are requested to do an NPS-OPS RT-PCR. If positive with NPS-OPS RT-PCR, you will be managed as a confirmed positive case. If you are negative with NPS-OPS RT-PCR and still symptomatic, you will be assessed and will be evaluated for your symptoms and to isolate for 3 days. Return to work if asymptomatic for at least 1 day or mildly asymptomatic with improving symptoms or as assessed by Employee Wellbeing Clinic. If asymptomatic with high-risk exposure to someone with COVID-19, check if exposed healthcare worker had a prior COVID-19 episode. If with previous COVID-19, check duration of recent exposure from COVID-19 episode. If less than or equal to 3 months or within 90 days from illness, testing is not required. Monitor for development of symptoms, and if with symptoms, follow guidelines for symptomatic cases. For more than 3 months from illness, testing is recommended. If no previous COVID-19, testing is recommended. The initial screening is still antigen testing. If asymptomatic with high-risk exposure to someone with COVID-19, the initial screening to be done is a rapid antigen test. If positive, you have to isolate for 7 days, and day 0 is the day of the test. Return to work after 7 days, and you will also be required to teleconsult with employee health during your positive days and before going back to work. If negative, do NPS OPS RT-PCR. If with a positive NPS OPS RT-PCR, manage as a confirmed positive case. If with negative NPS OPS RT-PCR, we have to check if you are fully vaccinated. If you are fully vaccinated, return to work with close monitoring for development of symptoms. If with symptoms, follow guidelines for symptomatic cases. If you are not vaccinated or partially vaccinated, you will be requested to do a 14-day quarantine. Regarding the updated COVID-19 screening procedure for healthcare workers, the majority of healthcare workers who develop COVID-19 presents with very mild symptoms. Those who are diagnosed with moderate, severe, or critical COVID-19 will require longer isolation, at least 10 days. Return to work clearance shall be issued by Employee Wellbeing Clinic or with infectious disease specialist of choice for consultants. Almost 99% of MMC healthcare workers received the primary series of COVID-19 vaccination. For the very few healthcare workers who are not yet vaccinated, they are highly encouraged to be vaccinated against COVID-19. Unvaccinated or partially vaccinated healthcare workers who develop COVID-19 and continue to have symptoms beyond 7 days of isolation may be required by employee well-being clinic to complete 10 days of isolation. All healthcare workers are highly encouraged to avail of booster doses of COVID-19 vaccine. Contact your unit or department vaccine coordinator for more information regarding schedule of vaccination. Everyone should continue to comply with infection control measures to prevent acquisition and transmission of COVID-19. Trainees are requested to report to Infection Prevention and Control Department and Employee Wellbeing Clinic if they tested positive. Once the isolation period has been completed, secure a fit-to-work clearance from Employee Wellbeing Clinic. Here is the IPC numbers that you can contact. You can message us through Viber or text message, or you can call us with these two office numbers. This is the last slide of the presentation. Thank you very much and stay safe. You may raise your questions after this presentation. Thank you.